So the next topic is adenoid. So what is adenoid? So you can see this is the adenoid gland. It is normally this much shape, but when there is adenoid hypertrophy, so you can see the shape is increased. So in large adenoid, so you can see this is present in nasopharynx. You can see here there is eustachian tube opening. So obviously it blocks the eustachian tube. So it blocks the eustachian tube. So blocking the eustachian tube leads to serous otitis media and hyponasal voice because this adenoid blocks the nose. So patient will present with adenoid voice, hyponasal voice, and patient will present with nasal obstruction. So because there is obstruction in nose, so you have to breathe because you won't survive without breathing and nose is obstructed. So what will you do? You will do the mouth breathing. Patient will present with sleep apnea, high arched palate. Okay. And why this adenoid got hypertrophied? So it is because in hypertrophied in response to the allergens. Okay. So what is the adenoid? Adenoid grows till 7 years of age. Then it atrophies till 20. It is the normal phenomenon. Okay. In case of adenoid hypertrophy, in case of enlarged adenoid, it blocks the eustachian tube and it blocks the air passage and eustachian tube. Okay. So this is adenoid hypertrophy. So you have to understand in adenoid hypertrophy, nasal obstruction, mouth breathing, sleep apnea, high arch pelvic, serous otitis media, and hyponasal voice. Okay. Now, how will you identify that it is entroconal polyp or adenoid? So because adenoid is a complete mass, there is no, it is a solid. So there is no any air present between the pharyngeal wall and adenoid because it is a solid. But in case of entroconal polyp which originate from the mastoid and ostium, so there is a air present between the pharyngeal wall and polyp. It is not seen in adenoid hypertrophy. You can see this. Okay. Now treatment. So treatment in case of adenoid hypertrophy, you have to give anti-allergics. You have to give anti-allergics, and because adenoid is enlarged, so you have to surgically treat and you have to remove that and you have to do adenectomy. Now you will ask me, sir, uh, why we are doing adenectomy? Is there any rule? So because it already get atrophied by the age of 20, so if you remove this adenoid, then there will be no harm to the patient. Okay, like we do in tonsillectomy in tonsillitis. Okay, so what is the complication of adenectomy? The hemorrhage, and it is done in rose position. Both head and neck are extended by keeping the sandbag under the supine position. Okay, indication tonsillectomy, rose position indication is tonsillectomy, adenectomy. And what is the contraindication? It is Down syndrome. So you have to understand this is the difference between entroconal polyp and adenoid. Okay.